When we hear the words high blood pressure, most of us imagine an older person, someone taking daily medicines, someone carefully avoiding salt, someone who visits the doctor often. We almost never imagine a child. But the truth is, high blood pressure is no longer limited to adults. Children and teenagers are increasingly being diagnosed with hypertension. And the most worrying part is this: high blood pressure in children usually shows no clear symptoms. It quietly damages the heart, kidneys, brain, and blood vessels. By the time it is discovered later in life, the damage is often permanent. Understanding this problem early can protect a child's health for the future. What is hypertension in children? Hypertension means blood pressure that is consistently higher than normal. But in children, blood pressure is measured differently than in adults. There is no fixed number like 140/90. Instead, a child's blood pressure depends on their age, height, and gender. Doctors compare the child's BP with standard charts. If the BP is above the 95th percentile, the child is considered to have hypertension. If it falls between the 90th and 90th percentile, it is called elevated blood pressure or pre-hypertension. That's why proper measurement, correct cuff size, and multiple readings are extremely important. Why childhood hypertension is increasing. In earlier generations, childhood hypertension was rare. Children walked to school, played outdoors for hours, ate mostly home-cooked food. Today, lifestyle has changed dramatically. Children spend more time sitting. Screens have replaced playgrounds. Fast food has replaced traditional meals. As childhood obesity increases, cases of high blood pressure in children are rising as well. Childhood obesity, the biggest risk factor. Obesity is the leading cause of hypertension in children today. Extra body fat puts continuous pressure on the heart and blood vessels. Fat tissue releases chemicals that make blood vessels stiff. Stiffer vessels increase resistance to blood flow. The heart has to pump harder to circulate blood. Over time, this leads to high blood pressure. Obesity also increases the risk of diabetes and high cholesterol, which further worsen blood pressure control. Common causes of childhood obesity include junk food, sugary drinks, large portion sizes, and lack of physical activity. Diet and eating habits. Diet plays a major role in childhood hypertension. Many children today consume too much salt, sugar, and unhealthy fats. Foods like chips, instant noodles, pickles, bakery items, and fast food are extremely high in salt. Sugary foods like chocolates, cakes, ice creams, and soft drinks add excess calories with little nutrition. Salt is especially harmful. Regular high salt intake causes blood vessels to tighten, which raises blood pressure silently. Children who develop these habits early often carry them into adulthood. Healthy eating habits formed in childhood protect the heart for life. Screen time and sedentary lifestyle. Another major contributor is excessive screen time. Television, mobile phones, video games. Children who spend more than 2 hours a day on screens are at a much higher risk of obesity and hypertension. Screen time reduces physical activity. It affects sleep quality. It encourages mindless snacking, poor sleep and stress in children. An often ignored factor is poor sleep and chronic stress in children. Late-night screen use, irregular sleep schedules, and academic pressure disturb the body's natural balance. When children don't get enough sleep, stress hormones like cortisol increase. These hormones raise heart rate, tighten blood vessels, and slowly increase blood pressure. A well-rested child with balanced routines has a healthier heart and mind. Family history and genetic risk. Hypertension often runs in families. If parents or grandparents have high blood pressure, children have a higher risk. This happens due to genetics and shared lifestyle habits. But genetics does not decide destiny. Healthy eating, regular physical activity, and early monitoring can greatly reduce the risk. Secondary causes of hypertension. Sometimes high blood pressure in children is caused by another medical condition. This is known as secondary hypertension. Possible causes include kidney disease, hormonal problems, heart conditions, or side effects of certain medicines. Identifying the underlying cause is essential for correct treatment. How doctors diagnose it? Diagnosing hypertension in children requires accuracy. Doctors use child-sized blood pressure cuffs. BP is measured on multiple visits. Results are compared using age-based charts. Additional tests may include blood tests, urine tests, ultrasound, ECG, or echocardiography. Diagnosis is never based on a single reading. Warning signs. Parents should not ignore. Most children with high blood pressure do not show obvious symptoms. But in some cases, warning signs may appear. Frequent headaches, dizziness, blurred vision, unusual tiredness, or difficulty concentrating. These signs are often ignored or misunderstood. Regular BP checks are the only reliable way to detect hypertension early. Long-term effects if left untreated. If childhood hypertension is left untreated, its effects can continue into adulthood. It increases the risk of heart disease, stroke, kidney damage, and early cardiovascular problems. Damage that starts in childhood often becomes irreversible later. Early action can stop this progression. Prevention at home and school. Prevention starts at home. Parents can encourage healthy meals, limit junk food, promote outdoor play, and reduce screen time. Schools also play a crucial role. Healthy canteen options, regular sports and physical education, health awareness programs and checkups, small daily habits make a big difference. Conclusion. Hypertension in children and adolescents is a growing health concern worldwide. The main causes are obesity, unhealthy diet, excessive screen time, stress, and family history. But the good news is this. With awareness, early detection, and healthy lifestyle choices, childhood hypertension can be prevented and controlled. Our next video is on the resistant hypertension. If you found this video helpful, like the video, subscribe to the channel, and share it with parents, teachers, and caregivers. Small awareness today can prevent big health problems tomorrow.